It's great to be here. And no one I would rather be in partnership with than Cecilia Boone. I don't know how many of you have gotten to know Cecilia, but she's basically devoted her whole life to women's issues and to her philanthropy and through her work at the Dallas Women's Foundation. Again, and not the easiest area of the country to work on these issues. She's helped raise millions of dollars for women's issues, domestic violence issues, job training. And if that weren't enough, she actually agreed to chair the Planned Parenthood board at the same time we were being defunded by the United States House of Representatives. So she never, yeah, exactly, does not shrink from a challenge. As we say in Texas, she's the kind of woman who'd charge hell with a bucket of ice water. So anyway, Cecilia, thank you for everything you do for women every day and for your partnership. And it's great to be back with Michelle, who we did get to know each other back when I was working with, Jane Fonda was sort of our connection. And so it's wonderful to see you again. And thanks for the work that you're doing and the Women's Funding Network. And to Anu and Jamie and Heather, I'm glad I got to hear that last presentation. That was fabulous. And actually, I'm not going to tell you how we're going to solve all the problems we're in, which somehow Michelle seemed to have promised. But I do think there are some threads here that are common. And I mean, I think there are reasons to sort of feel hopeful. I want to thank all of you, Michelle, Cecilia, all of you for all that you do on behalf of women's lives. And we try to do our part at Planned Parenthood every day, from Kibera to Quito to Hattiesburg, Mississippi, to Sioux Falls, South Dakota, because we know that whether or not women can plan their families and plan their lives is directly linked to their destiny. And of course, as we're increasingly learning in the US, and this was, I think, a topic of the last panel, is that simply having legal rights doesn't mean anything if you actually can't access health care and control your own bodies. And that having a constitutional right under Roe isn't worth much if there are no clinics left in the state of Alabama. A reporter asked me this week, when did women's health become so political? I know, I was like, I really could not keep myself from laughing. I was like, are you kidding? I mean, we were born in controversy. So I like to kind of remember that 97 years ago, Margaret Sanger opened the first family planning birth control center in the US in Brooklyn, a little tiny storefront. And for 10 cents a piece, she and her sister Ethel would hand out pamphlets about birth control to women. It was completely illegal, but from the very first day, women were lined up down the block with baby buggies and babies in their arms. And now 10 days later, a woman, an undercover cop posing as a mom, busted Margaret. She was thrown in jail, where she immediately started teaching all of her fellow inmates about birth control. And that is really how the movement was begun. Then, of course, fast forward to 1960, when the FDA approved the birth control pill, which I think is probably the single most important medical advance for women in that century. And then 5 years later, another Planned Parenthood employee, Estelle Griswold, was arrested for providing birth control to married women in the state of Connecticut, and took her case to the Supreme Court, which established, of course, the right to privacy, established the right for married women to get birth control, and that really changed everything. And it was that right to privacy in the US that then, of course, led to the eventual decision, the Roe decision, that allowed women to choose whether or not to continue a pregnancy. You know, it's kind of amazing. In the decades after the pill became available, and this is really illustrated, I think, by the Guttmacher statistics today, maternal deaths in the US dropped by 52%, and infant deaths went down 72%. And after Roe, of course, almost immediately, and I think it's important that they mentioned that it was young women, almost immediately, young healthy women were no longer dying in emergency rooms in the United States. So this ability to plan pregnancies, not only, I mean, it saved women's lives, but of course it also just opened up a whole all kinds of other avenues for what we could do. It made possible for generations of women to finally pursue education and to pursue a career. Actually, there was a recent study that says that fully a third of the wage gains that American women have made since the 1960s are a direct result of the birth control pill. So that's a pretty direct benefit. Today, of course, women actually outnumber men in the United States workforce for the first time, and we are scientists, and we are doctors, and athletes, and astronauts, and funders. as a result. And by God, in my lifetime, a woman will be president of the United States of America, okay? So we're making all this progress. So of course the question is like, how in God's name in the 21st century are we still fighting about birth control? Well, my mother used to quote Edna St. Vincent Millay, who famously said, life isn't one thing after the other. It's the same damn thing over and over again, which I think really explains the last couple of years. Although I do believe, and again, I think it was illustrated in the case in Mississippi, when women stick together, we are unstoppable. And so I want to use one example, which is the Affordable Care Act, which has been mentioned. This is actually, in the U.S., the single biggest advance for women's health care in decades, if not a century. And you better believe it didn't come without a fight. Just to give you an idea, and I love that we're in Michigan because it's a great Michigan story, just to give you an idea of what it was like in Congress to fight for women's health care to be covered under the Affordable Care Act. The Senate literally was arguing about whether or not maternity benefits should be covered by insurance plans, okay? You don't get much more mom and apple pie than maternity benefits. But Senator John Kyle of Arizona famously stated at a hearing that he was against the coverage because, quote, I don't need maternity care. That would seem a rather obvious point. But the wonderful thing is, the great senator from the state of Michigan, Debbie Stabenow, was at the hearing, yes, came right back at him, you're gonna love her even more, came right back at him without missing a beat and said, I bet your mom probably did. It's the only time in a Senate hearing I wish they had instant replay. It was a beautiful moment. But those were the kind of fights that we had, but it was because of Senator Stabenow and Senator Barbara Mikulski, who just never gave up. That in fact, there were protections put in for women's health care in the Affordable Care Act. First, and I like to repeat these even if you know them because we've got to tell this story. For the first time in this country, insurance companies can't charge women more for insurance simply because they're a woman, right? There's no more gender rating in insurance plans. The second thing is that women's preventive care, our annual checkup, our breast exams, our pap smears, now covered, no copay anymore under insurance plans. And of course, and I think probably most importantly, because you've all heard poignant stories, maybe even in your own family, for the first time insurance companies cannot refuse to cover women simply because they have been a victim of domestic violence or they have survived breast cancer. In short, being a woman is no longer a pre-existing condition in the United States of America, and that's a huge thing. But then we had this other little fight, you may have been reading about in the paper, and after hundreds of thousands, literally, of letters and comments to the White House, to the Department of Health and Human Services, rallies and Facebook posts, there's no sweeter moment in my history, not only as Planned Parenthood, but honestly, in my history as an organizer, which is all I've ever done, than a year ago when President Obama called. And it was interesting, I'm sitting at my desk and he's calling 3 organizations that day. The Catholic Conference of Bishops, the Catholic Hospital Association, and Planned Parenthood. And he was calling me to tell me that he was about to announce at the White House that for the very first time in the history of the United States, all women, no matter where they work, will have their birth control covered for no cost. That is equity, that is justice, and that is incredibly important advance for women. But we got to keep fighting for this. You know, you may have read, we already have 46 lawsuits challenging the birth control benefit. One of these cases is going to the Supreme Court. So just this week, Planned Parenthood and allies around the country delivered 350,000 comments to the Department of Health and Human Services in support of the birth control benefit. And we collected them online, and we collected them from men, and we collected them from women from all 50 states. That's what happens when you organize, and frankly, when we organize together. So we can't let up, you know, it's no time to step back, because there are millions of women and men in this country who need access to sexual health services and care that can change their lives. And I think one of the things, and I think it was mentioned earlier, I'm sorry I missed the earlier panel, but that means also delivering care in ways that are relevant to next generation. Now, I don't know about you, but for my kids, if it is not on their cell phone, it does not exist in the world. That is the only place they find things. In fact, 87% of young people now admit that they sleep with their phone every night right next to them in case any message should come in and they can check it immediately. Now, you do not have to raise your hand if you also sleep with your cell phone. But it literally is, I mean, it is the way now young people are accessing the internet. Not on computers anymore, right? It's through their phone, and that's even truer for low-income young people who may not have and often don't have a computer. The great thing to me about cell phone technology, it is beginning to erase the digital divide, not only in the United States, but around the globe, and we're definitely seeing it Planned Parenthood. As Cecilia mentioned, so we see 3 million patients a year through our health centers for health care, but our website now is averaging 5 million visits a month through computers and through smartphones. You can type in your zip code, you can find a Planned Parenthood health center anywhere in America. So we're like the Fandango of reproductive health care in this country. But it's fascinating, it's not only in the US. Every 2 weeks, our website gets a visitor from almost every country in the globe. So it literally is erasing, and I think providing access to information. In fact, when we launched our Spanish language site, Planned Parenthood en Español, 95% of the visitors were from outside the US, primarily in Latin America. And that, to me, is powerful, because that means you can actually get information about topics like abortion or sex education that may be taboo in your country or in Texas, for example. It's the truth. I'm not going to get in a match here, though, about Texas, Mississippi, because I think we both have evidence to show we're the worst. But the other thing is we've also learned, though, that it's not enough to have just information out there in a land, that young people in crisis, they need more than a website, right? They need to actually, in their terms, talk to someone. And that's why we launched this new program to text and chat with young people who are in a crisis. We're hosting a program that now allows us to text with thousands of kids every single month, just like a young woman who texted the other night. And I mean, it's just extraordinary. She doesn't text like, "Hi, my name is Judy," and blah, blah, blah. It's immediately, her text was literally this: "I think I'm pregnant and I can't be. I can't tell my mom, and I don't have the money to have a baby." That was it. So we texted back, "Well, we're glad you reached out to us, and did you have unprotected sex?" Well, she replied right away, "Yes, last night." Now, it's clear she has been up all night. She didn't mean to have sex, sounds like. She's convinced she's pregnant, and she's convinced her life is coming to an end, and she has no one to talk to. So we were able to text back, "Well, if you don't want to be pregnant, you can still take emergency contraception, the morning after pill." And there's a slight delay in the text, and then she texts back, "I can," with an exclamation point and a question mark, which I think is the universal symbol now for thank God. It was extraordinary. So we got her an appointment that day to get emergency contraception. That, to me, is breaking down barriers and making change for young people. Now, the exciting thing about it, you may have heard about the court decision this week, is that actually if that federal court decision holds, and we hope that it will, from now on out, she won't even have to go to the doctor to get a prescription. She can go straight to the pharmacy and get emergency contraception. That's really powerful. But to me, that is exactly what reproductive justice is all about, and I'm glad we had this conversation here, because it is about making it easier to get what you need. It's about erasing stigma. It's about taking away shame and bringing down the kind of barriers we have. And that does mean going to all parts of the globe and all parts of the country where equal access is not, it's still an aspiration, but it is absolutely not a reality. And that includes places like Alabama, which frankly is in a sort of this celebrity death match with Mississippi over who is the worst on sexual health outcomes in the United States. And I was really glad Jamie talked to you, gave you a little reality therapy about how hard it is to work in these states. These are states that have the highest teen pregnancy, highest teen birth rates, highest STD infection rates, highest HIV infection rates, and lack of healthcare access and lack of docs. So what she described, I would really like to reinforce. And not coincidentally, these are the states that are facing the worst bills in the country, trying to even further restrict, through really bad legislation, women's access to care. And yet, so it's really bad, but the resilience, which you sort of saw in Jamie, but I want to say, the resilience of women in the South, I'd put up against anybody on this earth. So these are women like, yeah, no, absolutely. They're extraordinary. Women like, and I'm not going to give you her name because she has so many threats against her, but like our medical director in Atlanta, who flies 2 days a week on a plane to Alabama to provide abortion services to women in a state where there are very few options for them. Or our healthcare center manager in Mobile, Alabama. Now, this is a young woman, Kiki Brooks, who, when I first met her, she told me her story. She was a teenage mom, single, raised her 2 kids on her own, and got them both through college. Now, Kiki then also put herself through nursing school, and now she gets up every morning and opens the Planned Parenthood Health Center in Mobile. And now, the morning I went to meet her, she said, well, you're going to have to meet me real early because I got to open up the health center. So I got there real early before the center was open. Well, Kiki's already not only made coffee, but gone and bought some Krispy Kreme donuts for us at the center. And she proudly showed us around the center. And this is a place that they are providing health care, and they got nothing but 2 nickels to rub together down there in Mobile. By the time we finished talking and the staff was getting ready to open, women were lined up down the block. Women who'd driven from Pensacola, Florida, women who'd driven from Mississippi. It actually reminded me of the pictures I've seen from Margaret's early days. And a lot of them were young women, women like Kiki, women that she counsels. And she asks them about their dreams and their hopes for their lives. And she talks to them openly and honestly about what it takes to be a teen mom and helps them make their decisions. Working for Planned Parenthood is her way of giving back, doing so much with so little. And so we're partnering with her and with our medical director in Georgia to not only rebuild in Mobile and Birmingham, but to expand. And in fact, we just opened our first full-on women's health center in Hattiesburg, Mississippi. So there's hope out there. And just started demolition in New Orleans on a plot where we're going to build the first full women's health care center in New Orleans, Louisiana for Planned Parenthood, because this is what it is to me, and I think it's kind of the theme of what we're talking about today. It doesn't matter if you have legal rights, if you can't get health care, right? It doesn't matter. We can insure the entire nation through the Affordable Care Act, but it's a hollow promise if you live in Jackson, Mississippi, and there's no doctor there to see you. So that's what we got to be about. As Secretary of State Hillary Clinton said, you know, women's rights are human rights, and human rights are women's rights once and for all. Now, that's true around the globe, but it's just as true in the good old US of A. When women have rights, when women have access to education and to health care and to opportunity, women prosper, and we know that. We've seen it ourselves. We see it every day in our clinics. And when women prosper, their families prosper, their communities prosper, whole countries prosper. So for me, we have to invest in the future, and that means mobilizing and organizing a whole new generation of young women and young men who believe in women's equality, and that's where my hopes are. You know, it's interesting because in the last 2 years when we were totally on the ropes in Congress, when they were trying to defund us, and being defunded in states all across America, it was the young people who carried us through. In the last 2 years, as Cecilia mentioned, we did gain 2 million new members, but 1 million of them were young people. And we doubled our campus chapters from Old Dominion to Missouri State. And it's funny, you know, because folks often ask me, when are young people going to appreciate all that we've done for them? And when are they going to really thank us and realize what's at stake? Well, first of all, they're our kids. They're never going to thank us. That's not what they're supposed to do. That's not their job. Our job is to make this fight their fight. And I do have to give credit, because it wasn't just us, it wasn't just a movement. I get to give credit to the U.S. House of Representatives and Todd Aiken and other folks who crystallized for young people what this fight is about in this country. They understand what's at stake, and they are taking on this fight. So I'm incredibly optimistic about the future. And it is not a time to give up, and it is not a time to give one single inch. Now, I got to admit, sometimes I get discouraged. Now, because it can get tough. Though when you're from Texas, there's not much we haven't already seen. But I think about the fact that 97 years ago, Margaret was thrown in jail for providing the same information that we now provide free online to more than 50 million folks 24/7 each year, okay? Or that Estelle Griswold was arrested for providing birth control in Connecticut in 1961, and this year, women in the United States will all have birth control covered in their insurance plans for no cost. That's progress. And I think about the fact that in the first half of the 20th century, nearly half of all maternal deaths in the US were the result of an illegal abortion. And today, abortion is one of the safest medical procedures in the United States of America. Now, none of that happened by chance. And yes, we're fighting some of the worst legislation we have ever seen, from North Dakota to Mississippi and everything in between, and we're not winning everything. But in the process, we're organizing and we're mobilizing leaders of the next generation, and I have confidence in them. They won't go back. Change is not inevitable. Change happens because there are folks who believe that the future can be better, and they make it happen. It was extraordinary in January, as a lifetime organizer, to sit on the Mall in Washington, D.C., and hear a president actually pay tribute to those folks who risked arrest and risked their lives to make our country more equal. He said, "We the people declare today that the most evident of truths, that all of us are created equal, is the star that guides us still, just as it guided fighters before us, through Seneca and Selma and Stonewall." President Obama recognized these courageous fighters of these movements, and today I want to add all of you to that list, because each era demands fighters and organizers and folks who give a damn. So thank you for keeping the faith. It's an honor to do this work with you. Thank you.